Okay. Right. So again, don't forget to sign into your attendance. What else? Yeah, I'm going to share with you the cost pro forma and cost information, okay, for this course. Okay, so if you refer to week 1, which is today, 15th of March 2022, I have upload the lecture notes, the cost pro forma, and also the current course information for this semester. Okay, but before we go on to our lecture notes, I just want to have a quick check with you about the course information. Okay. Right. So let us look first at our cost pro forma. Okay. So actually, the cost pro forma is just the summary of the program, okay, or the courses. Okay. So in this case, the cost pro forma is for this course. Okay, to let you know that the course code is actually SQB2020, which is the survival data analysis, and it is a 4-credit course. All right. And then this is the course learning outcome. It's too small for me, right? So at the end of the course, we are expecting you where you should be able to identify the appropriate techniques and models in analyzing survival data. Okay, so what is survival data? I will explain to you later. Number 2 is to evaluate the goodness of faith of the survival model. Number 3, to interpret the results of the survival analysis. Number 4 is to specify suitable statistical software to perform the survival analysis. And for this part, we are usually using our statistical software. And there are some packages which is suitable for the survival analysis, which I will guide you later during the lab session, which is not today. Okay, it will be, like throughout this course, right? So you can refer the details in the current course information. And number 5, the course learning outcome is to develop the theories and conceptual framework for the survival modeling. Okay, survival modeling. Sorry. Okay, so this is the current the synopsis of the course. Okay, course content, where I'm going to teach you the basic concepts such as survival and hazard functions. Okay, some of you never heard about it. Okay, some of you might have an experience about it. And then the survival data analysis, including the life table. Okay, the Kaplan-Meier, the log-rank, and Wilcoxon test. Okay, and then we are having the survival regression modeling, which is the common one is the Cox regression model, and also the several parametric models, and also the accelerated lifetime model and risk model. Okay, so we are going to proceed with the diagnostic checking of the models, application to the real data sets. Okay, so for this weightage of this of the assessment, I think most of you are interested with this. You really want to know like how many how about the assessment for this course. So the continuous assessment is 50% and final examination 50%. So what I will do is I will assign you to do an individual assignment, which is available in week 6. Okay, so I will specify the date. Okay, so individual assignment, the carry mark is 20%. It's in week 6. And the group assignment with the online presentation, the carry mark is 30%. Okay, and this group assignment, okay, you will do a presentation in week 12, right? And then in week 13, we are going to have a revision class, while in week 14 will be your final examination. Okay, these are the flow of the assessment weightage for this course. Okay. All right. So any questions so far before I move on to the current course information? Okay, so if there is no question, I'm going to proceed with the current course information for this course, right? So I'm not sure why is it like all the formats are everywhere. So I think I need to fix it again. Okay, so this is all about the information. Okay, what is the main references that we are going to use for this course? Okay, so at the moment, okay, we are focusing, the main reference is the reference number 4, which is the Collette 2015 Modeling Survival Data in Medical Research, okay, which is the 3rd edition, Chapman and Hall. Okay, I think like my style, I will usually share the ebook with you. Okay, I will upload it next week. Okay, and then supplementary reference such as reference number 1, 2, and 3, and also number 5. You can read yourself for further understanding. But I will use Collette book as the textbook or main reference. Okay, so usually like I don't know why I didn't put it in number 1. Okay, so I should put the main reference as number 1, right? Okay, so this is my details. Okay, and I don't know whether some of you already know me. Okay, so my name is Dr. Nur Anisa Muhammad. Okay, and okay, so I'm a senior lecturer. Okay, and I'm teaching this course, and before that, I also taught the research methodology in statistics, which is the SQB2001. Some of you might seen me before. Some of you are very new. So this is the first course you are taking with me. So yeah, hello and welcome. Okay, so our class is on Tuesday, 6 to 9 p.m., 6 to 9 a.m., 6 to 9 p.m., right? So we are going to use 2 medium platform, which is the Spectrum and Microsoft Teams. Okay, since it's online course throughout this semester. So all the information that you, and I also need to add on here where the quick information we can, I'm using WhatsApp group, okay? So you will get quick information from WhatsApp and also in Spectrum and Microsoft Teams, right? So we are going to have a lecture and tutorial and also the lab session, okay? So it will be on Tuesday, okay? So usually what I will do my lecture first, and then 1 hour before we end the session will be either the tutorial or the lab session, okay? All right. So again, the detail of assessment weightage, your individual assessment and group, individual assignment and also group assignment with online presentation, where the carry mark for individual assignment is 20% and group assignment with online presentation is 30%. And the individual assignment is expected in week 6, while the group assignment with the online presentation, you need to submit by week 12. While your final examination, the carry mark is 50% and it is expected in week 14. Okay? So these are the details, right, for the topics and activity throughout this course. Okay, so these are the details. You can refer back to this course information. Okay, so I'm expecting to have weekly face-to-face lecture or online lecture every week. Okay, unless like if I'm not feeling well or anything, I will inform to you to switch to the pre-recorded session and etc. Okay. All right. So any question? No question. So is the number increasing? Stop sharing. Okay, so it's decreasing. Okay, just now it's 21. Okay, suddenly it's reduced to 21 reduced to 20. Okay. Right. So if there is no question, okay, we are going to take uh, 3 minutes break, okay, before we start with our lecture 1, okay. Okay, so to begin our lecture, okay, since that I just uploaded everything today, what I want you to do is actually to open Spectrum and open the lecture note, okay, um, and read the content of the first lecture notes, okay. So have a read through And we are going to start our first lecture at 6:30, where I'm going to explain what is survival analysis. Okay, so please refer to the first lecture notes, okay, which is available um, in your week 1, okay, here, right? So just click here and have a read through, okay, because since that I'm doing it, I'm just unhide it a few minutes ago. So, and you don't have time to look at the materials. So I will give you time, okay, to read through the lecture notes first, and I will go through to these lecture notes and explain to you what is the survival analysis, right? All right, so have a look through. I give you 10 minutes to read the materials, and then I will come back to this, okay? Okay. Oops, sorry. Okay, so if you look at my lecture notes, it's actually a summary from the main textbook, which is Collette book. Okay, so this week we are going to give you some introduction about what is survival data analysis. Okay, so if you look at the definition here, right? So survival analysis is actually a data analysis or analysis of data that corresponds to the time from a well-defined time origin until the occurrence of some particular event or endpoint. Okay, so in this case, particular event like death. Okay, so um, okay, so these are the definition, meaning that you should have a starting point and also the ending point. Okay, so for example, life of a machine components, the duration of strikes, time to complete a task, time to a death after entry to a clinical trial, etc. Time to remission of a disease, time spent in remission, duration of pain relief, time to recurrence of a disease, and also time of failure of transistor. Okay, so these are the survival time or survival data. Okay, where you have well-defined time origin and also you have some particular events or the endpoint. Okay, so if you look at this table here, okay, if you look at this table, you have P1, P2, P3, P4. So P present the patients, right? So this patient, okay, they have a starting point from the origin, okay, at the time origin, and then they finish at T1, okay, and then go to the second patient. Okay, the patient doesn't start at the time origin, but it starts somewhere after uh, the time origin. Okay, so they starting in somewhere, but still in the study time. Okay, and then finish at before the end of study. Okay, so here, if you look here, the x-axis represent the study time, and your Y represent the number of observation or patients. Okay, so and then if you refer to the third patient also didn't start at the time origin. Okay, but the patient is still considered in the, sorry about that, just a moment. Okay, sorry about that. So if you look at the third patient, okay, the third patient doesn't start at 0, but it started somewhere, but still in the study time and finish by the end of study. Okay, so we name them C2, C1, C2, T1, and T2. Okay, there's a meaning for that. Okay, T1, T2, C1, and C2. Okay. All right. So if you look at the fourth patient, okay, so the patient number 4 starts at somewhere, okay, and then finish before the study time, right? So this is actually, if we talk about survival data, you must have mentioned about the time and also a particular events, okay? Okay. So the special features of this survival data. Okay, so data is highly skewed. Okay, so usually you play around with the symmetrical data, but when you deal with survival data, it is highly skewed. Okay, it's highly skewed to the right. Okay, why is it highly skewed to the right? So it cannot have a negative value, right? Since that it's involved time. Okay, You can start at 0 or any time between the study time, but your data will be highly skewed. Okay, this is the first criteria. The second criteria, the special features about survival data, is the censored observations. Okay, what is the censored observation? If you refer to the first graph that I show with you, you have patient 1 with T1, patient 2 with C1, patient 3 with C2. Okay, so C1 and C2 represent the censored observation. What is censored observation? Censored observation is actually endpoint not observed for all subjects, such as patient still alive at the time of analysis, or patient lost to follow-up, or patient dies from unrelated cause. Okay, for example, if you are studying about a cancer patient, like a cancer study, okay, the observation or the patient considered as a censored patient if the endpoint, okay, is not, I mean, like, maybe like the patient dies because of accident, or maybe the patient died because of other cause, right? But not due to the cancer, right? Or maybe like the endpoint, we don't know what happened to the patient, right? So this is the case where the patient lost to follow up, okay? So in this case, we consider the patient as censored, okay? So these special features, which is we allow censor to happen for this survival data, we can have several types of censoring, which is the right censoring, the left censoring, the interval censoring, informative censoring, and there are many types of censoring like independent censoring, etc. But these are the common types of censoring. Okay, so for this master's course, I just use the right censoring for the throughout this course. Okay, so what is the right censoring means? The endpoint occur after observe the survival data, right? So the left censoring, it is less common, but still happen, okay? And the interval censoring is a failure experience within some interval, okay? And another informative censoring is a censoring occurs due to reason known and unrelated to study, okay? So these are the types of censoring, okay? So for this course, throughout this course, we are going to just use the right censoring, okay? I don't think I'm going to touch about the interval or the left censoring. Okay, so since it is only a master's course, so I just touch about the right censoring. Okay, so maybe like if you want to touch the interval censoring, maybe we can try to study that in your assignment, or maybe like extra workshop or something. Okay, so the focus here is just using the right censoring, right? So these two features is very, very important. Okay, so especially the censoring types, censoring observations. And to do so, we need to have some assumptions, right? So these are the assumptions concerning about censoring, where your T1, okay, where the time point 1 for the patient 1 and censoring 2 must be independent, meaning that patient 1 and patient 2 are independent. They are not related. Also, the end time are independent as well. Okay, so the reason for dropping out should not be related to the course of therapy. That is, censoring must be non-informative. So in this case, like to fulfill this assumption, okay, therefore we are not going to include the informative censoring in your study as well. Okay, so for that, to fulfill the assumption, number one, you must make sure that the endpoint, okay, for patient 1 or patient 2 or patient I and patient J are independent. Independent is a must, okay? So you need to fulfill the independence issue. And number two, your censoring should be non-informative, okay? Right?
Sorry, doctor.
So, yeah.
For the right censoring, endpoint occurs after observed. Is it mean previously the patient is survived, but after we collect the data, then the patient become dead? Is it the meaning like this?
Yeah. So usually like what we do, we put some time for ending, for to begin and to end. So what right censoring, it means that the patient um, is a censored patient, but the event occur after the study time, meaning that whatever happened, the patient lost to follow up or whatever, we don't really consider them. So that is why we just use the right censoring in our study. Is that okay? Is that explained to you? So like in this case, patient number 3. So we consider the patient number 3 as censoring, right censoring. Why? Because the patient starts somewhere but not at time origin 0, and they finish until the end of study. So this patient number 3 is a censoring patient because we don't know what happened to this patient number 3 after the end of study. Okay? Does it
Or
make
is
sense?
it still alive, still survive after end of study?
Yeah.
Oh, okay. So for
Okay.
T, the T, is it not sensory? Not
Event
sensory.
happen. Maybe the patient dies because of because of the study. For example, like die because of cancer. So
Oh, okay, thank
that
you.
is why patient number 1 is considered as T1. Okay. So the black one is death. C1 is censor. C is censoring. T is events. So time survival data. Okay, if you look at the definition, so it says that it involves time. Number 1, it should involve time. Number 2, um, until the occurrence of particular events or endpoint, meaning that you need to have time and you need to know what happened to the patient, uh, at the end of point. Okay, so this is the thing. Like if we talk about survival, what is survival data? To 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 make it short, is a time to event data. Time to event data. Okay, so it's involve time and event. Okay, so these two keywords, and then you should know the types of of the data. You must have the censoring. Like for the survival data, it allows censoring. Okay, and also the data is highly skewed to the right. Okay, so these uh, are the characteristic of the survival data. And number 3, you must make sure that you fulfill the assumptions. Okay, what is the assumption? You must make sure that your patient are independent. Okay, and also the censoring types must be non-informative. So in this case, the patient number 3, okay, considered as a censored patient because whatever happened to the patient after the study, um, we don't want to know. Okay, because the patient capable to complete the study, but we are not, and the patient still survive at the end of study, but after that, we are not follow up from there. Okay, unless that we are doing a follow up study. Okay, so for this particular case, you can use survival analysis for your study. Okay, so yeah, I'm welcome for the questions. Okay, before I move on to the next slides. Okay, do you have any questions so far?
Hi, going to ask, do that means the censored data not going to involve in the analysis?
Censored data is not involved in the analysis. We need censored data.
Oh, so
Where
now we're going to study the censored data instead of the event happened, the T1, T2.
the
Then
event and also the censored data.
both.
So
Okay.
the thing here that I would like to highlight is actually, um, I'm not sure. I think the special case about survival data, they allow censoring. If you do any data analysis, if we have censoring, we just assume it's missing values or something. But this survival data we considered as a as a censored observation. Okay. Right. So any question? Any question? Okay, so I think I'm going to stop until example 2, which is data 2, the leukemia data, and we are going to continue the survival function, the hazard function next week. Okay, so today is just to give you a brief introduction. What is survival analysis and what is survival data? What is the special characteristic for the survival data set? Okay. Right. So any questions so far before I move on to the examples? Okay. So if you look on my right hand side here, okay. So I just want to focus on these two data sets, which is I know it's not a complete data set. Okay. Usually, if you involve a real data set, I think like we are going to have more number of patients. Okay, so this one is just a simple example where we have which involve a hepatitis data. Okay, so this actually, if you look at this data set, okay, this is actually a survival time. Okay, so this is actually a survival time in months, right? So the following data refers to survival time in months from the data from the date of entry into a clinical trial of 14 male patients with chronic active hepatitis. Okay, so here, just to give you a brief introduction, like if we look at this data, how do we know that this is actually a survival data? Okay, so if you look at these data sets, right, so we have 14 patients, okay, all are male, right? And you can see that these numbers are each actually like a survival times in months, okay? And you can see there is a star and hashtag there, right? So the label star means that the patient's still alive at the end of study, okay? And then the patient hashtag, okay, was lost to follow up after the entry to the trial. Okay, I think I just switch off my WhatsApp group. Sorry about that. Okay, oops. Where is my modeling? Not this one. Okay. Sorry. Sorry about that. Okay, because it's very like distracting. Okay, like usually like this time is like out of office time, right? So like I receive a lot of uh, text and phone call from my family and friends. So yeah, so they thought like I didn't have any class today. All right, it's okay. Okay, so as I mentioned earlier, if you look here for the 14 male patients survival time in months, you can see the star label for a patient who is survived at the end of study. Okay, while hashtag was labeled for lost to follow up in 14 months, right? So if we are not doing the survival data, if we just use the normal data analysis, we will assume that this week a patient with 40 months survival time as a missing data, right? But using the survival analysis or survival data analysis, this is a special characteristic that you can consider. I mean, like the 14 months of survival time in your analysis. Why? Because this patient is actually lost to follow up, okay, after the entry to the trial. So this, I mean, like this hepatitis data is actually doing by months, and at the 40th month, the patient, we don't know what happened to the patient, okay? Maybe the patient changed the hospital, maybe the patient moved to other country. We don't know what happened. So these are the survival are the censored data for 40 months, right? Okay. So, and you also need to make an assumption that your censoring are non-informative. Okay. So if it's informative, then you are having informative censoring. So in this case, for this course, okay, since that we are only focusing on right censoring, so we assume, I mean, like, to fulfill the assumptions, okay, number one is to make sure that our patients are independent, okay, and number two, you must also make sure that your censoring types are non-informative, okay. So that is why here is say he may have since died, but as we have no further knowledge of him, we record him as last known to be alive with survival time of 40 months. Generally, star and hatched patient are not distinguished. Okay, so these are the example of survival data analysis. Right, so any question before I move on to the second example?
Sorry, doctor. So for the patient who lost to follow up before end of study, so is it considered as left censoring and other is still alive is right censoring?
Why is it left?
Because lost to follow up, so we're not sure still alive or not.
No, I think this is still a right censoring, right? Left censoring is something different. I think what I will do next week is actually to explain to you in detail what is the types of censoring like. How does the left censoring look like? The informative censoring look like? The interval censoring look like? Is that okay? So in this case, we just assume that it is a right censoring, okay? Because yeah, right. So right. So any questions so far? Okay. The reason I said that it is a right censoring because we didn't mention when is the end of study, right? Okay. So we can see here if because these data have been sorted out in ascending order. If you can see here in week 28, it is considered as a patient still alive at the end of study. Okay. So we don't know when is the end of study period. So that is why I assume that this data is actually a right censoring data. Okay. Because if you look from the definition that the right censoring is actually an event happens after the end of studies, right? So in this case, we don't know what is the time of end of studies. So that is why it is very hard to evaluate whether it is a right or left censoring. So in this case, I presume that 40 hatch, meaning that these censoring types for, I mean, like this 40 months, right, is considered as right censoring because a patient with 28 months is also alive at the end of study. So I believe that the study time is shorter than that. Okay. Are you okay with that? Right. If there is no question, shall we move to data for leukemia data? Okay. If you look here, there are two groups, right? So one is treated with drugs and another one is a control groups. Okay, so here it is about the remission times for leukemia in weeks. Okay. So what is actually remission? Remission means that you've been treated with the, I mean, like you are recovering from leukemia, but it relapsed. I mean, you fall sick again, right? Due to leukemia. So this is the remission time from leukemia. Okay, so we have two groups. One is treated with drug. This is called the 6-mercaptopurine. Mercaptopurine, 6-MP. while the other group was treated as control. Okay, so you can see here, like the star represent the censored observations, right? So we have observations for 6 MP, while in control, there is no censored observation, right? So you can see that this has been sorted out. So you can see that patient with stars is the censored observation, right? So which is quite different for a control group, okay? Where there is no censored patients for the control group. So this also been considered as survival data analysis. Okay, so if you are not using the survival data analysis, you still can analyze this data, but with this censoring data, you will consider them as a missing value, right? Because there will be no information about the data, so you would just consider them as a missing value. So since that we want to know the this is actually a time to event data. So you want to know, you want to analyze the data correctly. So you use the survival data analysis, and you can consider this censored observation in your analysis. So that is the special characteristic of the survival data. Right. So I think we should finish off our today's lecture, where I just want to give you some brief introduction. What is survival analysis, and also like the special characteristic about this data. Okay. So next week, I think next week would be more serious work, where we are going to introduce you what is the survival function and what is hazard function, and also how to calculate the median and the percentile and etc. So I'm also going to share with you for next week class. I'm going to share with you earlier the content of the lectures, where it's not just here. So we are going to continue with other topic as well. So right. So I think for this week, since it's an introduction, it will be quite short, because I just intentionally want to give you some brief idea what is survival analysis all about. Okay, and also like I'm going to upload the ebook as well, so that you can have a look for that textbook. I'm going to do it now, and then and also I'm going to share with you the lecture 2, because next week will be we are going to use full 3 hours, okay, to conduct the lecture. And also we are going to start with the first tutorial, which is tutorial 1 for this class. Okay, I think next week, besides of just sharing with you the survival and hazard function, I'm also going to introduce you the Kaplan-Meier estimates, to calculate how to calculate the Kaplan-Meier estimates, and also the life table. Okay, so that's it for today's class. Oh, it's quite short. It's only like now is, yeah, it's still not 7 o'clock. Any question? Any doubt about survival data analysis? Do that mean censored data not going to be involved? No, because it's a special characteristic. You should include the censored data in your data analysis. Okay, so that is the special features, right? So it is involved time and also the events, right? So I think like most of you are quite confused with the survival data is because of the censored things. But yeah, that is the special characteristic about survival data analysis, where you allow censored observation in your analysis. Okay, so I think like you can see clearly next week, where we are going to use the Kaplan-Meier estimator to calculate, and you can see that how the censored data is going to be included in your analysis as well. Right, so I think I should stop recording. Any more questions before we end the session?